Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
Establishing healthy habits in childhood can lead to lifelong benefits in adulthood, and it starts with a healthy heart. Dr. Leanne Crittlebaugh, President and Chief Medical Officer of Children's Health Pediatric Group, and Dr. David Sutcliffe, Pediatric Cardiologist at Children's Health Heart Center and Assistant Professor at UT Southwestern Medical Center, join us this morning. Good morning. How are y'all?
Good morning.
Good morning.
Good to see y'all. Okay, first of all, what tests, Dr. Crittlebaugh, should be conducted as part of a well-checked visit to ensure good heart functioning and prevent heart disease?
Well, so the things that we check in childhood when you come for your well visits include checking a child's blood pressure, and we do that very early at the age of 3, looking for any signs of high blood pressure.
I didn't realize it was 3.
Yeah, we start right away because there are some things that children can be born with that could cause elevated blood pressure. And then we also screen for cholesterol universally when the kids get a little older. We used to screen just if there was a family history of high cholesterol or heart disease, but we learned we were missing some kids doing that. So now every child between the ages of 9 and 11, and then again between 17 and 21, ought to be screened for high cholesterol.
So if a child has a history of heart disease in the family, should a child have a heart screening?
Well, the short answer to that question is definitely. So most families will think of heart disease as synonymous with coronary disease and heart attack, which is really largely seen only in adults. But there are a lot of other heart diseases that can present in childhood. For example, rarely decrease in heart function can occur in settings such as inherited cardiomyopathies, but much more common, like Dr. Crittlebaugh was just mentioning, high blood pressure and weight gain in children is a rising problem. And identifying these children early and getting them to people like Dr. Crittlebaugh and myself can help prevent more problems later down the road.
So there are a lot of over-the-counter medications that kids take. How do those affect a child's heart?
Well, so in general, a healthy child, we wouldn't expect it to have any effect on their heart. But it will, those medications like cough and cold medications will sometimes raise your heart rate. And where we get into trouble is if parents don't pay attention and give too much of the medicine, or they may be buying one medication thinking it's for the runny nose symptom and another medication and thinking it's for the cough symptom. And in fact, they're both the same medication or very similar. You give doses of each, and then you've really given them a lot of stimulant.
A lot of teenagers have a really busy schedule and may start their day with a caffeinated drink and then drink a few during the day. How much caffeine is too much, and what are the side effects of caffeine for a teenager?
Sure. Well, me too. But as kids often go, it's difficult to say how much is too much. It depends on age and size and many other factors. But what I will say is that children are much more dramatically affected by caffeine than adults. 100 milligrams in a child is getting close to too much versus 400 milligrams in an adult. And at that level, children can start to develop faster heart rates, higher blood pressures, more frequent urination, and even risk dehydration. That's in normal children. Children with medical problems, and especially heart disease, are at much higher risk and should avoid caffeine altogether.
There are a lot of kids on ADHD medications. What about caffeine interaction with those?
Well, those medicines we give for ADHD are generally stimulant medications. So they already will be raising the child's heart rate a little bit and potentially raising their blood pressure. In fact, we check their blood pressure when we have them on those medicines. So if you add caffeine or other stimulants to already that baseline, then you're at much higher risk that their heart rate or their blood pressure will become significantly elevated.
Cold and flu season almost upon us. How do viral infections affect a child's heart?
Well, so in general, the colds and flu that we see in a healthy child isn't going to cause any trouble. They will have a higher heart rate when they have a fever, but that's normal, and in a healthy child, it shouldn't be a problem. In rare cases, there are some viruses that can actually infect the heart and cause damage to the heart muscle and make it not pump as effectively, but that's actually quite rare.
The most important thing is people want to prevent heart disease, any heart problems in their children. What's the best thing to do?
So what we would recommend is that they eat a healthy diet and get a healthy amount of physical activity, because we know that obesity or being overweight is a very big risk factor for heart disease and high blood pressure and lots of other things. So eating those fruits and vegetables, healthy diet, making sure kids get plenty of opportunity to play actively every day for at least 30 to 60 minutes are the best preventive medicine.
Good lifelong habits. Yes.
Absolutely
Thank you
right.
both very much for coming in today.
Thanks for having me.
You can go to childrens.com/heart for more information about your child's heart health. You can also stay connected with Children's Health each day by following them on Facebook and on Twitter.
At Children's Health, we're dedicated to helping today's dreamers grow into tomorrow's doers. With care closer than ever, we'll always be by your side.